This last clip is going to look at the knee joint. And while I talk about it, I'm going to take you back and forth to a few pictures. And the first picture I want to look at is over here. Okay. So this when bones come together, you recall we call them articulations. So in this joint, the surfaces are quite shallow or condyloid, and this is the meniscus right here. Okay, you can see the medial, that's the one inside, and versus the lateral, and the joint is enclosed by a capsule posteriorly, and laterally we have ligaments to keep it stable this way. An important thing to the knee joint is muscle tone. If someone has an injured knee, very often they'll do quadricep exercises for them to help strengthen the muscle to keep the knee very stable. So when you're working on some of this, there's a number of diagrams, so I think it's really important to identify the parts. So as I said earlier, the knee joint's a large and complex joint. It's a hinge joint, and it is the combination of 3 bones. So we have the fibula, you always remember that, the little bone with the big name, and the tibia, the big bone with the little name. And of course we have the femur up here. Anteriorly, the patella. Now the patella slipped down here. We've cut the tendon from the quadricep muscles that would be up here. And because of this, we get limited rotation, very limited. We shouldn't be rotating our knee very much. And we get extension and flexion. Remember, it's a hinge joint. So let's go back and look at a couple of other pictures and just identify. Okay, again, this is if you look at that, remember it's all of those things about a freely movable joint, synovial fluid, articular cartilage, etc. Okay, and you can see the patella here. This is all representative synovial membrane. The menisci you can't see all that well there. Okay. This one helps you see the muscle coming down from the quadricep muscles. And you see this is the tendon. Tendons connect muscle to bone. And then down here, what we have instead is a patellar ligament, because it's going to connect this knee bone or the patellar to the tibia down below. I want to we're going to mention these later. These are the cruciate ligaments right there inside. So back to this picture, because I think it's sort of the best. We have the menisci, which are these cartilage pads that just kind of sit like they're glued on top of the tibia there. And what they do is they deepen the joint somewhat for us. It's not a very, very deep joint, but it tries to stabilize the joint and prevent the rocking side to side. But they're a little bit of a poor design, if you can say that, because they're really only glued here. Glued isn't the right word, but attached. But imagine, so that doesn't make that attachment that strong, and therefore they're subject to injury quite easily. They are responsible for the absorbing the shock to the knee. So we've talked about the patellar ligament. Now ligaments connect bone to bone, bone to bone. And then, as I said, up here, this tendon would be connected to the quadriceps muscles, which is a group of muscles up in the top of the thigh. We have 2 ligaments, collateral ligaments. We have the fibular or the lateral, okay, versus the tibial, okay, or the medial. So they're coming from the top of the femur and going down to connect themselves down into either the tibia or fibula. And keeping those very strong are very important to maintaining the preventing medial rotation of the knee or lateral rotation. The the cruciate ligaments are important. So cruciate refers to cross, and you can see that they cross here, okay, versus here, creating this X-shaped structure inside, and that X-shaped structure then further makes that joint more stable. But you can see there's lots to injure here. That's the other part that's not so good. Now, take a look at this picture because I want to demonstrate the muscular structure. And you can see, so here's our collection of muscles at the top called the quads. And there, this is what's going to attach to the patella. And then this is the ligament below. So you can see that keeping these nice and strong will really help that joint be nice and stable. And this picture here just demonstrates the capsule that's around it that we talked about, that's always in a synovial joint. And lastly, this looks like a very bad thing. So the hockey puck has hit this person on the side of the knee, and you can see how people get knee injury here. So our stabilizing factor of the cruciates broken, and we've got some ligament trouble here and here. So knees are complex, they're vulnerable to injury, and yet they're just a really interesting joint to examine, and you can see how people can get a lot of knee trouble because, of course, osteoarthritis can get involved anywhere where we have articular cartilage, you know, from wear and tear. So not just injury, it could even end up with osteoarthritis. We have a number of people, there are a number of people who end up with knee joints in their 50s and 60s being replaced. So that is all of the clips for the skeletal system.